Good morning to all of you. We will commence the program with a prayer by Ms. Irene, and sorry for the delay due to the technical issue. Ms. Irene.
Good morning, everyone. Welcome to Isbat University. We welcome all our special guests to the inauguration meeting of the Faculty of Health Science and Health Sciences programs here at Isbat University. And at this point in time, let's humble ourselves for prayer. Heavenly Father, we thank you for each and every day you have blessed us here on earth. We thank you for the gift of life and for all the beautiful things that are around us and beyond. We thank you for our chairman, chancellor, vice chancellor, faculties and administrators at Ispat University. We thank you for our very important and special guests who are present here today for the inauguration of the Health Sciences and Health Sciences program at Isbat University. Lord God, Father, we pray for our students. Give them wisdom, perseverance, and courage to excel in the programs which they have chosen to study. Protect them from all disease and illness, especially from the coronavirus, even when they are studying from home. We ask you to bless today's program and all of the themes and content which will be discussed. Help us to gain new knowledge and information in the field of public health and health sciences. Finally, Father, guide us through today's program. Bless the hands of the dedicated people who have prepared and organized this meeting. In your mighty name we have prayed. Amen. I now invite our Vice Chancellor, Isbat University, Professor K.M. Matthew, to give his welcome speech. Thank you, Professor.
Good morning to all of you. Our special guest, Dr. Charles Oloro, Director Clinical Services, who is representing Director General of Health Services, Ministry of Health, Government of Uganda. Professor John Charles Okeria, Chairman, Allied Health Council, who is also chairing the today's session. Dr. Levi Magani, Senior Research Manager, TASCO, who is representing Executive Director, TASCO. Dr. Patrick M. Fikma, Registrar, Allied Health Council. Dr. Robert Mendela, Acting Dean, Business and Management Faculty, Isbat University. Mr. Sunil, Senior Lecturer, Information and Technology Department, Isbat University. Ms. Irene, our librarian and PRO here. All the technical team under the leadership of Mr. Manjesh, and all my participants for today's launch. On behalf of our Chairman, Board of Directors, Mr. Varis Mundamatam, faculties, staff, and students of Isbat University, I welcome you all for the launch of the Master of Public Health course in Isbat University. Isbat University is one of the reputed universities in Uganda with the state-of-the-art infrastructure and internationally experienced faculties. The university was awarded the charter established by His Excellency, the President of Uganda in the year 2019. The university has students from more than 24 countries, and it has an international arena for the students. Our aim here is to create job creators and not job seekers. So for that purpose, any students who has joined here or who was planning to join this university for any course, I ensure that you are taking a wise decision to join the Ispac University. The university has a very tested infrastructure, which you already seen, very high technical infrastructure, and we have the best ERP system in the country. Our ERP system was visited by various universities and other organizations for benchmarking the ODL system and online examinations. We were one of the first university given a permission to roll out the ODL university in Uganda. We were also one of the first university given permission to conduct online examination with the artificially enabled face recognition technology and safe browser system. By this, we are maintaining the sanctity of the examination. Even the students are sitting at home and appearing for the examination at their comforts. This all was tested and accredited by the National Council of Higher Education. And I am very proud to say that Ispac University is one of the first universities conducting examination in such a very high technical platform. Now, as far as healthcare and healthcare system is concerned, we all know even the developed countries in the world was under the puzzle when this pandemic started in the beginning of 2020. Unfortunately, we are in a very safe country in Uganda, and I congratulate His Excellency, the President of Uganda, all the officials of the Ministry of Health, and all other concerned agencies and healthcare takers for containing the spread of the virus and keeping us safe in Uganda. Comparatively, we are much better off than any other country in our neighborhood or any other of the parties. But as far as healthcare system is concerned, we have to do a lot. So with these intentions, our chairman, Mr. Varis Mundamata, was taken this initiative for introducing the Faculty of Health Sciences in our university. And today is a very auspicious day. We are launching the Master of Public Health, which is going to commence on the 2nd of October in this university. Some students have already joined, and some of them are on the way to join these courses. This is going to be one of the best courses available for any healthcare students who want to improve their academic qualification. With all the experts from Ministry of Health and other healthcare department is here, I will not talk much about the healthcare as of now. They all will be talking and you will be able to listen to them. With this introduction, I take the opportunity to welcome all the dignitaries. First of all, Dr. Charles Olaro, the Director General, Director Clinical Services, who is representing the Director General of Health Services. He is the Senior Consultant Surgeon and Director Clinical Service in the Ministry of Health. He has a Master of Medical Surgery and Master of Science in Health Services Management and Master of Business Administration. He is the right person to be here to inaugurate our launch of Master of Public Health. On behalf of everyone present and on behalf of the all faculty, staff and of the university, I extend a heartiest welcome to you, sir. We have Dr. John Charles Okira, Chairman, Allied Health Council, present here. He is an expert in healthcare and Master of Public Health teachings, very experienced and very expert faculty member. He is also going to chair this session, and I sincerely welcome you for this today's session. Please, on behalf of everyone, we welcome you, sir. We have Dr. Levi Mwengi, representing the Executive Director, TASO Uganda. He has a PhD in Biostatic from Belgium and Masters in Biostatic from Belgium. He's a senior biostatician and research manager, TASCO Uganda. He also voluntarily worked in the University of Public Health before joining TASO Uganda. And we, on behalf of everyone and on behalf of all the staff and faculty, we sincerely welcome you for this today's launch. We have Dr. Patrick Pima, Registrar, Allied Health Professional Council. On behalf of all of us present here, we sincerely welcome you for this launch. We have Dr. Robert Mindela, the Associate Professor and Acting Dean, Faculty of Business and Commerce, Ispac University. He is a very experienced lecturer and international, with having a lot of international experience. I sincerely welcome you for this. We have Mr. Sunil, who will be giving you some presentation. I sincerely welcome. He's a senior lecturer in our Faculty of IT. I welcome you for this session. We have Mr. Manjesh, who is heading the technical team, and I welcome Mr. Manjesh and all the technical team. And I also thank Mr. Manjesh, Mr. Shamim, and all the technical team for organizing this thing. I also welcome all the participants abroad the country. They are watching from all over. Some of them will be joining. I cordially welcome all of you for this session and wish you all best wishes. Thank you very much.
So we are going to have a presentation by Mr. Sunil, senior lecturer here at Ispac University. Mr. Sunil, you're most welcome. Please go ahead to make the brief presentation about Ispac University. Thank you.
Thank you, madam. So first of all, a very good morning to all the dignitaries present here and to all the audience who is viewing this MPH launch. So it is my immense pleasure to give the brief about Ispac University. So we started our journey in the year 2006 by getting the Inception OTI accreditation by NCHE, and in the year 2007, we got associated with Sikkim Manipal University, one of the best university from India, and we got approved by NCHE as well. In the year 2011, we got accredited as classified and registered OTI by NCHE. And in the year 2013, we got accredited as a private other degree awarding institution by NCHE. So again, in the year 2016, we got accredited as an university, ISBAT University by NCHE. So in the year 2018, our virtual learning environment or the distance learning accreditation by NCHE as well. And in the year 2019, so we got the highest accreditation in the country, which is the charter status. And by 2024, so it's our vision to have our Ispac University extended residential campus. So this is our progressive journey. As you all can see, so we have progressed step by step, and we have achieved the highest status by the NCHE. So the vision of Ispac University. So our vision is to become the most sought after destination for quality higher education in business and STEM focus within the East African region. So here STEM is meant by science, technology, engineering, and mathematics. So we are focusing in becoming the leader within the East African region in delivering both the business and the STEM domain. And the mission of the university is to provide an enabling training and research environment for societal transformation. And when it comes to the philosophy, we follow this philosophy at the university. So the philosophy of Ispac University, it describes as transforming the mind to enhance the socio-economic sustenance. So how do we achieve this philosophy is very interesting here. So we follow the hybrid blended learning model. So we have three main pillars which we follow in this model. We have an on-campus model, we have off-campus model, and we also have skilling and upskilling programs. So with all these models blended together, we have this hybrid blended learning model. So this is the holistic approach we follow as our philosophy. And we also have several international associations and partnerships. So we are the leaders in the IT delivery here. So some of the IT organizations like Red Hat, then we have iOS developer, AWS Academy, Microsoft, VMware, Oracle, and DC Council. So we have all these associations and partnership with all these IT organizations. We also have association with UCAM University, as well as the Association of Commonwealth Universities, and we are in the way to get IACBE accreditation for our business programs as well. So talking about the infrastructure at Ispac University. So we have the state-of-art infrastructure. So we have one of the best infrastructure at the university across the Uganda. So we have smart lecturer rooms, we have science laboratories, we have new age computer labs, a multimedia studio, and a well-established library. And these are some of the highlights of our infrastructure. So I'm not going to take much time about explaining this. And one of the major component which we have at Isbac University is we offer hybrid blended learning platform. So this is one of the specialty about Isbac University. So we have this hybrid blended learning platform, which is offered to all the stakeholders of the university, which means the faculties, the students, the parents, the administration, all are included in this process of learning. So that's the reason we call it as an inclusive learning. So through this hybrid blended learning platform, we are providing several features like profile management, online study materials, online assignments, online tests and quiz, online mentoring, discussion boards, news and events, fee statements, alumni database, placement cell, and many more. So with this hybrid blended learning model or the platform, even if the student is not at the campus, the student will get all the required information, all the required skills or the delivery, which is provided by the faculties and the university. So this platform is available for the students in several platforms, like the students can access this platform through the web. So this is one of the sample screenshot of our VLE platform. And the platform is also available on the mobile, even on the Android and iOS. So as you can see, with this blended learning platform, the students can get all the services. So they feel as though they are in the campus. So at Ispac University, we have 4 faculties right now. As of now, we have Faculty of Information and Communication Technology, Faculty of Business and Commerce, Faculty of Engineering, and we are launching Faculty of Health Science today. And In the next intake, that is spring 2022, we are also in the process of introducing the Faculty of Science Education at our university. So these are some of the programs which we are offering right now under the Faculty of Health Science. So we are offering the Masters of Public Health in general, Masters of Public Health in Health Informatics, Masters of Public Health in Epidemiology and Biostatistics, Higher Education Certificate in Public Health. So I request Professor Dr. John Charles Okira to provide more information on these programs.
Thank you. Thank you very much for the opportunity. So, good morning, ladies and gentlemen, those ones in the house and online. And so, this is yet another very critical day in the journey of ISBAT University. I found myself as one of the consultants establishing this faculty. And from the analysis and from the surveys that were done, it was critically found that we need to have a Masters of Public Health as one of the first programs that you're going to be launching in the health sciences faculty. But then in-depth surveys showed that there is a big group of people who are interested in doing the Master of Public Health, the General Masters of Public Health, sometimes called to be the generic. And so, and you know that in line with the Ministry of Health and the global direction, we are actually putting a lot of emphasis in public health, prevention, prevention, prevention. So the general aspect of it is that we have a Master of Public Health, which is the generic one. And then we have the Masters of Public Health with a specialty in health informatics. And then we have a Master of Public Health, Epidemiology and Biostatistics. And it's also critical that we have had the higher education certificate in public, really not a higher education in public health. The higher education is in health sciences. And the program is expected to attract those persons whose qualification would not allow them to do degree courses in Uganda, but their qualifications are equated to all level of Uganda. They undertake 1 year course and be able to join the degree programs. And so, like you put on the screen, these are basically the major objectives of the program that I have been trying to highlight. And so there is definitely a need for specialized skills. If you get back to the previous slide, when we were talking about the different electives, the informatics, this is really one of the major aspects currently now here we are having. And it's probably the niche that ISBAT University has to have a priority category of people who are bringing technology into public health in terms of providing technical support to be able to introduce new things in public health. I wouldn't be interested in saying about the general objectives because everybody can read this. But I want to talk about the niche and of the informatics, that here then you should then be able to incorporate in the healthcare service delivery aspects like voice detection. Instead of you having to write everything and take records, you should then be able to save time and do these aspects like the syndromic surveillance, aspects like the secure texting, shifting to the cloud, and also predictive analytics. And these are generally things of today. So as you undertake this program, you find yourself a niche above the rest. So this is the only program so far offered in Uganda around that has a specialized elective of health informatics. Epidemiology and biostatistics, all of us are aware that this is basically with the disease surveillance, causes, how to prevent, and then also we are talking about the risk factors. And the biostatistics brings into the use of this data to make meaning and information for healthcare. So these are specialized persons. The overall aspects of these programs are really that the entry requirements cut across. So you should be able to join. You don't need to be a health provider, a health worker to do these programs. You can't come from the background, especially the generic Master of Public Health. You should come from any background, a teacher, a politician, an engineer, a social worker. You qualify as long as you have a bachelor's degree from a recognized institution and an experience in service. You should then be able to enroll in this program. So it cuts across. So it's not necessarily that you must be a health professional to be able to be in this program. So I invite you to take up this initiative to be able to enroll in the ISBAT niche programs of informatics, biostatistics, and epidemiology. So because if you have to be a epidemiologist, you actually don't need to be a doctor first. So you can have a journey to run for ISBAT and career professionals to a higher level. Thank you.
Thank you, Doctor, for providing in-depth information about the different programs we are offering in the public health. So I'm happy to announce we are in the process of providing other programs as well under the Faculty of Health Science, which are Bachelors of Medical Imaging Technology and the Bachelor of Medical Laboratory Technology. So we'll be starting these programs from the next intake, which is spring 2022. Okay, so thank you for providing me an opportunity to provide the information, a brief on Ispac University. So thank you, one and all.
All right, so we shall move on to the inaugural speech. The inaugural speech is going to be given by Dr. Charles Olaro. Dr. Charles, you're most welcome.
Thank you very much, Professor K.M. Matthew, the Vice Chancellor of ISBAT University, and all your faculty staff, Professor John Charles Okiria, the Registrar of the Allied Health Professionals, Dr. Patrick Mpima, colleagues Levy and Professor Robert, all the other members who are connected online. First, I bring apologies from my senior colleague, the Director General, who could not come. But also I feel very happy to have taken this opportunity. I've been in his university a number of times, and I really would want to keep coming. So I will be able to speak on behalf of the Ministry on this inaugural address during the launch of the Faculty of Health Sciences in the ISBAT University, which is the International Business, Science and Technology University. So, as all of you are aware that the 1995 Constitution of the Republic of Uganda provides for all people in Uganda to enjoy equal rights and opportunities to have access to health services, clean and safe water and education, among others. So I'm talking that definitely what we're doing here is actually relevant to the government achieving what is that envisioned in the Constitution of the Republic. The Ministry of Health vision is that you should have a healthy and productive population that should be able to contribute to this economic growth and national development. I think the COVID pandemic has shown us what will all go wrong when health is affected, because everything will come to a standstill: education, business, all the other ones, the economy. So I think it really brings in forward that we really need to be able to address health, and health, as the ministry puts it, health is wealth, because if you don't have health, then you are not really, can't be healthy. The mission is to provide the highest possible level of health services to all people in Uganda through the delivery of promotive, preventive, curative, relative, palliative. And again, that's the what we'll be launching, the Faculty of Health Sciences is aimed definitely to contribute that. Because really we're moving from the focus mainly from the curative. Yes, I'm a director curative, but I'm well of those who are converted. And I really want that if we prevent more, then as a director, I don't get overburdened by all these other cases which happen. So the primary aim of, definitely the goal is to accelerate movement towards universal health coverage. And I think definitely, I'm sure when the students are in here, this is one of the areas definitely, because they definitely know that whatever we are doing is the context of universal health coverage to in promotion of health and productive lives. The primary aim of our national health policy is to inform, clarify, strengthen, and prioritize the role of government in shaping the Ugandan health system in all dimensions, including organizational health care and health assurance, prevention, and promotion of good health. And what's important here is developing human resource, which we think that ISBAT University, with the launch of the new focal Bachelor of Health Sciences, and as you have indicated, you are even intending to begin other courses on medical, biomedical engineering, medical imaging, and others. I think this is definitely the right way to go, because all of you are aware that as a country, we are having a workforce challenge. Government has invested a lot in the health infrastructure, many specialized institutions, but now we need that we develop specialized human resources to be able to run those facilities. So we are looking at as ISBAT as a partner to contribute to developing a committed, well-prepared, skilled, and knowledgeable health workforce, which is vital in achieving universal health coverage and the health sector development goals. So as a Minister of Health, we want to applaud the founders of ISBAT University. Particularly, we want to applaud the former World Bank UN technical advisor and a renowned philanthropist and educationist, Mr. Varghese Madmatam, in his quest to make quality education affordable and accessible in Uganda and the region. And as you have indicated, this dream started in 2006, and now is almost about 15 years. And the university actually is getting much more stronger. And I think definitely in recognition of this, government of Uganda was able to charter the university in 2019. So I think these are really hallmarks of work. So I would want to appreciate the university as they ensure that, as I've been informed, that they ensure that the tuition fees are generally affordable. I have looked at them to the common citizens while upholding the quality and the standards of academic delivery and scaling based on practical learning and real-time projects. We also recognize the university for fulfilling the social responsibility by offering bursaries to economically challenged and academically excellent students through talent hunt scholarships. The university also, we have informed, supports and encourages students in sports and giving bursaries to support such students who have got proven track records. So we really would want that this will continue, and probably will want to see that how does it expand, so that we do not deny really the people. Everybody should actually have got a right to access access education. I also take note that even during the unprecedented pandemic, I've been informed that you have continued with academic activities uninterrupted through the highly innovative methods of teaching using the advanced technology, which I think all of us have been able to see during our tour. And then the recognition and National Council of Higher Education allowing you to conduct online examinations. Those are major achievements. Even the bigger universities in these countries, I have not seen many of them who have been able to progress in that direction. So why are we here today? Because that was just the preamble. This is now the actual topic. We are here developing the launch of the Focal of Health Sciences, which is a new course in the field of public health by statistics and epidemiology, which play a very critical role in contributing to competent health professionals in health promotion, prevention of disease. All of you know that our burden of disease, almost 60 to 70% of this actually preventable. And yet the country cannot develop because there's a very big burden of disease. Because if all those resources were diverted to development activities, and people were able to be productive. So I think definitely and also empowerment of individuals. This comes with definitely, we need to empower individuals. We need to manage illnesses and disabilities. I'm also looking at this will contribute to the advancement of scientific findings, mainly if the students are able to do research, awareness campaigns, and influence new policy. I am sure definitely from the university, there are many things where you will be able to contribute to influencing health policy and potentially positively impact the lives of millions of Ugandans. It's even more relevant with emerging epidemics and pandemics like COVID, and we're now even dealing with now outbreak of polio and many others, that we are able to need these public health experts with the knowledge, as Professor Charles indicated, informatics, disease investigations, and real-time reporting and data management. I think these are really some of the things which we think that we really need to be able to innovate so that we really think the framework of health generally. I am aware that based on your background as a well-grounded IT faculty, university, this is going to impact on how the health sector is. And I think that many things which we need in the health sector is aspect of digitalization. I think we need to digitalize many of our things, performance management, accountability of all whatever we're able to do, and then definitely real-time reporting. So the Minister of Health is aware that ISBAT University is well recognized and respected for impacting high-quality education, training of Ugandans and regions with a highly focused skill, blended learning and training model to create employable professionals. As the Minister of Health, we look forward to receiving good products. I think that's really, yes, everything you will do it, but what you want is really a good product. We should be responsive, committed, well-prepared, skilled, knowledgeable health professionals, and able to contribute to solutions. We don't want to get people who will become problems. We should really get people who should be able to come to contribute to solutions to many of the population challenges. We are also aware that you have collaborations with other international universities, which gives ISBAT a cutting edge. And I think even in this you have indicated you get a professional edge over others. So I'm sure these courses will definitely be able to look at that. So as I end, ladies and gentlemen, Vice Chancellor, I want to once again thank the founders and all the contributors of ISBAT University for investing in Uganda and thus contributing to the socioeconomic transformation of these countries. So I think we are in this together, and the ministry and ISBAT, we shall be working together. Thank you very much for listening. So I think with those few remarks, it is now my pleasure this morning to officially launch the Faculty of Health Sciences of ISBAT University.
Thank you very much.
Thank you.
Very much, Dr. Charles Alaro. I now invite Professor John Charles Okiria, Chairman, Allied Health Council, to start the session. Thank you very much.
Okay, thank you very much, guest of honor. Thank you very much to the proprietors of ISBAT University and the words of wisdom guest of honor have given us should be the message that we're going to run through these programs. We are happy that Ministry of Health recognizes the input and the output from ISBAT University And cognizant of the fact that it's an international university, a lot of buy-ins and sellouts are going to happen through this institution. Ladies and gentlemen, I'm Professor John Charles Okia, the chairperson of Allied Professionals Council. I'm also a private consultant, majorly in health services and evaluations. I have the honor this morning to chair a session where we have some selected experts to give us some words of wisdom and encouragement and their views about this day of the launch. This marks the beginning of this program that has been designed to fit into the niche gap that has been in the health sector and provide training that's appropriate to the community needs. And with me are 4 honorable persons with vast experience, and we have had the Dr. Laro, the Director of Clinical Services, a person who is passionate about training, a person who is passionate about public health. And he has already said that much as the Director of Clinical Services, he would not mind having himself out of the job because we have actually improved the prevention. And I think that's a very serious point that he notes, that we are actually at a point where we need emphasis on prevention. And public health comes timely in terms of this. And he has also declared that the niche of informatics, the niche of biostatistics and epidemiology are the critical resources in public health. The competence and the skills that are going to be adduced from this are really the critical output that we are requiring now. We need an improved approach to management of health systems, public health. We need the technology to come into play. Otherwise, we can never continue doing life the same as usual. We need the accurate information. We need timely data. We need all the avenues to be exploited to make sure that service delivery becomes cost effective. So I want to take this opportunity to invite the first person in no particular order, Dr. Mpima Patrick, who is a registrar of Allied Professionals Council. Dr. Mpima Patrick has been introduced. He's one of the persons who have turned around the health services in this country as a registrar. He was recently awarded a PhD honorary by Commonwealth University for his role in regulation and licensure and control and services in the health sector. He is the registrar for the Allied Professional Council Uganda that registers about 38 professionals, and he has risen all the ranks, and there could have been no better person to come here and share with us his experience, since his main domain has been also to oversee training programs, accreditation of curriculums, and ensuring that there's quality of service delivery. Dr. Mpima, we are glad that you have honored our invitation to join the family of ISBAT, to come and share with us your views. You can have yourself 10 minutes to share with us your experience. You're most welcome.
Okay, thank you, Chair. Professor John Charles Okia, who is my boss as the chair of Allied Professionals Council, Professor Matthew, the Vice Chancellor, Dr. Olal, the Director of Clinical Services, and all the other dignitaries who are invited to have a discussion on this critical moment when we are launching public health department in Ispac University. Now, Chair, mine is going to be an issue of structures. And I would like we look at the agenda, the government agenda as far as the healthcare service delivery is concerned. The government agenda puts emphasis on health prevention and health promotion. And our chief guest, Dr. Lal has already alluded to that we are supposed to provide care as per the government priority. Now the question is, who are the professionals to deliver the government agenda? Because we are now looking at what we call re-engineering. A lot of emphasis has been put on curative services. When you hear people talking in the villages, they talk about there are no medicine in the hospitals, there are no beds, there are no what. But people are not talking about the issues which must be put in place for them not to go to the hospitals. And that is where we have to put emphasis. So as we are launching these programs, we are looking at the health professionals who are going to deliver the government agenda as far as healthcare service delivery is concerned. Point number 2, do we have the regulatory framework, the law in place to ensure that the professionals on the front line in disease surveillance, disease control, data collection and the dissemination are part of the regulatory framework? Chair, you realize that by the time Allied Professionals Council Act came into place, the Public Health Board, which is enshrined in the Act, was talking about health inspectors and vector control. Only 2 we have mentioned, that is public health. But today, public health has gone beyond those 2 professionals recognized. And as a council, we have worked with Professor Charles Okilia as the chair to look at other professionals who follow under the bigger picture of public health. And we have looked at the health informatics. I'm very happy, Vice Chancellor, you are addressing the issues of who are the professionals in public health who are going to deliver the government agenda. Health informatics, we have already recognized people who are training in as medical records and health informatics. But as we are recognizing these people, we need the managers at master's level to manage the system. Because you can have the people who are going to work down there, but they need to be guided by properly trained managers. So they come in the place of the masters in public health and health informatics is addressing the critical shortage of managers in the health sector. So when we looked at all that, we looked at nutrition, we looked at health education and promotion, health informatics as new emerging cadres who need to be what? Properly regulated and put on the registers. Then another issue I would like to talk about. Once we have identified these cadres to deliver the agenda, we have cooperated and worked with universities to provide us with well-trained cadres. Do we have the structures? It's number 3. Do we have the structure to employ these people? This is now goes to the director, Minister of Health. Like most times, we train people. After training, we ask ourselves, where are they going to work? So we need to look at the issues of structure, right from the VHT at the village level up to the level of top management at the ministry. One of the positive change which has happened in the recent past, that when the Ministry of Health was being restructured, public health was given a full-fledged directorate. So it's now at the level of senior top management, where issues of public health have been given a critical hand by the ministry. So we need to look at the whole structure from top to bottom to see whether the professionals we are generating can be absorbed into the system. Number 5, that is the career path. We need to know how these professionals are going to grow in their career. We don't want somebody to come here to take a master's in health informatics. The following day, you find the person now doing other things. Says, I was frustrated with that course. The course has no career path. So we need to look at all of this. So, Chair, finally, I want to say that ISBAT has come handy at the right time to provide us with the much needed human resource for health in the areas of preventive medicine. So, Professor Matthew, we are going to cooperate. We are going to work with the university.
I want once more to thank, and sorry for the small shortfall in the technology. I want to thank Dr. Mpima for the insights he has put. One thing is certain to the audience out there, that the partnership that ISBAT University is putting across by getting into the senior health professionals, the people at policy level, to come and become their partners in this move is one sign that this is an institution of their choice, because it's not probably very common for you to invite the directors, invite the registrars, and persons who have very high profiles on new programs that people are not sure about. So I think from the insights of Dr. Mpima, it's very, very clear that the roadmap that ISBAT is following as far as public health is concerned is a long-awaited one. And so we want to thank you for your support. We want to thank you for your encouragement. I will allow the people out there, if there are any few questions after we have had the other guests to say their words of wisdom to talk. So one, thank you, because what you're putting across is what actually we needed to hear from a regulator. We needed to hear from a person who's a partner, and we needed the assurance of all things from a director, knowing very well the guest of honor that we have is one of the most highly rated academicians and professionals in this country in the sector. I am sure then from now on, if you're out there and you've been doubting whether you should come to ISBAT or not, you should be able to begin to have a feel that this is a home that you should be in the next minute after this launch. So I want to invite the next person, Dr. Levi Mugenyi, who will say a little bit more about himself and be able to share his experience and his views. Dr. Levi Mugenyi, you are most welcome, and the floor is yours. the next 10 minutes.
Okay, thank you, Chair. Dear guest speaker, I'm very honored to have come and join this panel to discuss about this program. I'm representing the Executive Director, TASO, wasn't able to make it today because of other important engagements. But I think he thought wise also to delegate me this time to come and be part of this. So as I'm a biostatistician, a senior biostatistician with TASO Uganda. I also had the I just completed my PhD recently in 2018 in biostatistics. So I just mentioned that the as we are put up is a very important one. The research in the field of health and diseases. And that's where biostatistics, bioinformatics, and epidemiology is more formed. So to mention, I recently tried to do research. I did some research on developing an app. And I remember guest speakers when we first met at Makerere University, when we are disseminating our results from the app, which was intended to help increase alerts for COVID-19 infection. And you find that this kind of platform is one way of increasing that kind of skill to the students. I had this idea, and it took me time to find someone who could help me develop this app. So you find that if we can incorporate biostatistics with ISBAT, which is more formed in technology, we find that we are going to competently improve health research, especially in the area of biostatistics, bioinformatics, and epidemiology. So at TASO Uganda, where I'm a senior biostatistician, we have been doing research in HIV, giving care to HIV patients since 1987. It's over now 33 years in existence. And so recent that we noted increase in NCDs among these patients. And I'm happy, Professor Charles, you thought wise that we also have a course on communicable and uncommunicable diseases, because it is becoming a serious burden according to the research we are doing. I'm happy to have joined several researchers at the University of Makerere, and we are currently looking at the vaccine itself. So I'm leading the statistical analysis of the vaccine, how it has been efficacious to achieve its objective. And we noted that this skill, many biostatisticians do exist. We have very many, I may say, but the skill of putting the theory in practice is still lacking. So we need to have, or to introduce in our program. I was trying to look at the schedule here, and I missed something, which I think, Professor Charles, we may have to sit and unpackage probably some of these course structures. For example, I miss, I don't know where it's going to be, a course on statistical programming. We have softwares which we use for programming, and it's the reason that universities like Hasselt University, where I did my PhD, they encourage practical experience. And with this software, if you not introduce
this kind of practical skills to the students, still we are not going to solve the problem. And I'm happy ISBAT is taking up this. And given the platform and where we have visited, we have seen that ISBAT is well positioned to support the students, both technological and also, this idea of having a wider coverage, not necessarily only Uganda, where you are supporting transferring this skill across the country and outside the country, is going to be very useful to see the research in health quite improved. So what can we offer as TASO? As I mentioned, we have a clientele of over 75 patients living with HIV, 75,000 patients currently living with HIV. And if the students probably are enrolled, we are likely to give a better platform where students can do their research. And that now we are seeing emerging NCDs. If you come to TASO, I think we are more positioned and ready to support the university in that research. And the other thing is that TASO has several facilities. We are not only located in Uganda, in the central. We covered all the 4 regions of Uganda. We have health centers, 11 of them, covering the whole country, meaning your programs will quite be supported by TASO, whereby the students are up country. If they're studying and they're studying online, they can still access the research sites at our points or at our health centers. I think that will be a great addition to the university. And we also have faculty members. We have people with PhDs and masters who can also offer supervision if needed to the students while they are at our sites. I think that's what I can mention, Mr. Chair. And I just want to say thank you for inviting me in particular, and also for recognizing TASO on this launch. Thank you so much.
Thank you very much, Dr. Levy, for those inspirational words. I have just had a communication here from the Vice Chancellor on my phone, and it's very clear to him he's committed. So everybody, every expert has an opportunity to be an adjunct faculty here. So you'll always be invited to give keynote speeches, critical guidance, and specialized lectures. Director, I hope when asked to do that, I know you have been usually doing it for other institutions, but this time my appeal to you would be give ISBAT a priority and also be able to come and blend the learning in this institution, sharing experiences across the board from all what you have been doing. I want to thank Dr. Levy for being part of ISBAT team. And for the members out there, you can realize that ISBAT normally does not settle for lesser quality people. He has a PhD in epidemiology and biostatistics. These are very rare qualifications at PhD level. So be there. So don't miss the opportunity to be mentored by such a person, because you probably will not get any of that caliber anywhere. So ISBAT is out to bring faculty of class and always be able to put up what is required. It brings in an issue of statistical programming, which is of course embedded in the curriculum, and ISBAT having the art of technology. I think this is going to be a walkover for the institution. So a very good prescription to be emphasized during training and learning, but also very, very important to understand that the institution has the capacity to carry it without any other thing. So this is the kind of specialty of graduates of this institution that we're going to be having. So you can see that to make a niche, you must have the facilities, you must have the right human resources, you must have the right atmosphere for learning, and ISBAT is providing all this for you, the Masters of Public Health students. So, and sometimes when you have good news should be shared. Make sure that you've told a friend where you've come to study, if you've already enrolled in the program, and make sure that as you come with 3 other friends, and that's how good news is shared. The management on this launch, already because of the high demand of the specialized courses and programs in ISBAT, already has some people who have been admitted for the program. Congratulations to all those persons who already decided to express their interest as pioneer students for this program. We have a formidable team. You can be sure that we shall put you in the perspective of public health with a special niche of skills and competencies. You can be sure that you'll be taught, you'll learn, you'll put your hands on, and you'll be given all the necessary exposure. We have, therefore, an opportunity to hear a word or two from one of the first applicants for these programs. Is no other than Dr. Anyango Alfred, and is expected to be one of the pioneer students come October. Dr. Anyango Alfred, are you online?
Hello, yes, I'm online.
Oh, Dr.
Hello?
Anyango, first of all, I want to thank you for the interest and the sincere feeling that you've had to join this program. It is really goes into the history that you are the people who pioneered the learning of this Masters of Public Health program in Isbac University. And I hope you're aware that Isbac University is a chartered university, and therefore your qualifications are globally recognized. We thank you for the interest, and we're looking forward to having you on board and in class anytime now. You have about some 10 minutes to share with us your feel as you join into the program. Thank you very much, Alfred.
Yeah, thank you very much. Thank you very much, Professor. Thank you very much.
Can you put your video
everyone?
for 1 second?
Hello?
Can you put your video for just 1 second? We want to admire your face. 1 second, I know that you sometimes disturbs and then you can go to.
Yeah.
Okay, well, let me not disturb your audio. Please go ahead.
Okay. Yeah, thank you very much. Yeah, I would like to appreciate you all, the management of Isbac University, pioneer students. I thought when I was applying, I was among the second or third lot, but that's so great that I'm one of them. I am a doctor working in Soroti. The real name is Dr. Anyonga Alfred, not Anyango, it's Anyonga. I've been in service for quite a long time. Was excited to see that Dr. Etukoit is one of the guests here. I once worked under TASO with Dr. Etukoit when he was in Kanyanya training center. And currently, I report daily to Dr. Olaro Charles and COVID treatment unit Soroti Center. Yeah, coming back to issue of being a public health student is a good opportunity to me to join Isbac University, and the same to my colleagues. And on behalf of all the students and Masters of Public Health in Isbac University, would like really to thank the university for giving us that opportunity as pioneer students. We pledge to work hard and make sure that Isbac University appears among the top on the market or the job market. We pledge to uphold our discipline while in the university, our moral behavior, to give the image of the university to be of a high level. As being the pioneer students, there have been questions left and right. How will the university treat us in terms of probably tuition, and then the learning sessions, how we shall take our learning sessions. But from your submissions today, we have got comforted a bit, like we are going to have a very comfortable learning period. Our feel is now that we are in the field, we shall be working as well as studying, which is which we would say that is a very good gesture by the university to recognize the need from the community that while one is studying should be able to provide a service. Ideally, ISBAT University is more than a university, but a partner to the community, because we would not love to have a situation whereby we are fully tied in class and yet we need to give a service. I particularly as a doctor, but giving me this opportunity to learn as well as providing a service is very good. I really don't have much for now, and ask the students, other than thanking you all, and we are really happy that the Ministry of Health through Dr. Laro has launched the MPH program in ISBAT University, which is now good for us. We shall be proud being the first graduates of Master's Public Health in ISBAT University. Thank you very much.
Oh, thank you. Thank you very much, Dr. Alfred Anyonga. I know you come from the land of the East, where I come from, where there are wise men. I think
Thank you.
You made the right decision to join ISBAT University, and ISBAT University, through their own consciousness, knows that there is no way you can launch such a program without partnering the parent ministry. And so the recognition and the presence of Ministry of Health here at that level is all an indicator that you are in a place of quality, you are in a place where your qualifications cannot be doubted, and people are recognizing that you have been trained properly and appropriately. Thank you very much, Alfred, and just make sure that you pass the message to your other colleagues, the allied health, the nurses, and this is home. And like I put it, the generic Masters of Public Health brings everybody, even for epidemiology and biostatistics, on board and getting you to understand your own skill. Discover yourself at ISBAT. Thank you very much. So we have now an opportunity to have few questions. I know we are running short of time. We basically should be ending in the next 10 minutes. So out there online, we could be having some people who would want to seek clarification. And I know with IT, all this is going to be in the YouTube. It's running live, I suppose. And all other venues, you can go and eventually follow it, forward it to a friend. But if now there are issues that you think you want the panelists, the guests of honor, the promoters of the institution to answer, you are most welcome. I give you 10 minutes to share your views, and then we can be able to close the launch and move on to other aspects of the agenda. Thank you. You can raise up your hand if you can, and we should be able to respond to your query. Even if it's a compliment that you are now you are satisfied, you've been clarified on your doubt. But what is very important as I wait for any hand up is that key messages to move with is that ISBAT is a chartered university. That means the highest recognition of a tertiary institution. 2, the programs of public health are accredited by National Council of Higher Education. And so you're not coming to do a program which is not accredited. 3 is that the infrastructure required in terms of faculty human resources, online reading materials, blended approach for learning that promotes you to do your work and also continue with their learning journey are provided for at Ispac. Yeah, okay. What is it saying?
John is asking, what are the teaching opportunities that you have for this program?
Okay, John is looking at the teaching opportunities. I am sure that you'll be part of the faculty. What, John, you need to do is to share with us your CV. We want to build a bank profile, a profile bank for many persons who are interested in teaching and learning. So the addresses of ISBAT are there. You should be able to share your CV and we look at opportunity because many of the faculty are going to be teaching part-time. So your areas of specialty matter. And so when called upon, you should be able to have. So please share your profile, share your CV with the university. I am sure that they'll be giving particular addresses where they can be sent, such that you are able to be at one time busy, consulted, to be an adjunct faculty, even a full-time faculty at one time. So opportunities are there. Then the other one. So the email has been shared. So you can use that to be able to communicate and be able to provide. And for these ones who are not aware, much as I am the chair of today's session, I'm also going to be one of the teaching faculty here. And so I'll be teaching. I have been teaching for several years. And don't miss the opportunity to be taught by one of the very hottest economists of this country. I will be part of the group, of the team, and you will then be able to turn around your research skills and competences and get yourself into the world of evaluations. And please, I am available. I'm going to be part of the team here. So you may contact other persons who have done Masters of Public Health in other institutions and see that the core team that has been around in many of the strong universities are the people that we are bringing them together here to share the experiences.
There's another question.
Yes.
How much tuition fees will be?
How much?
Tuition fees.
The tuition fee, I think the brochures have them. The details are there. Yes. It is 2.1, but the most important thing,
2.1.
yes, you have, we shall be sending the program structure, which has also tuition, and you'll be able to appreciate that the tuition that are charged here are on average very modest fees. It is 3.1 per semester, and for Masters of Public Health, this is probably among the best offers you can have in the market, with the high quality, high tech, and great atmosphere for learning that is friendly. Okay. And then I have also been told the good news is that for all the new applicants, the pioneer group, the university has extended a 25% scholarship. So it's automatic. So please make sure that you come with a friend, because these things don't come every time. These things come once for all. Actually, if I were not studying, I should become a student myself. And then I see how I should benefit from it. So this is from the horse's mouth. And so please, we are still receiving applications. Refer a friend and let a friend identify that you referred him to us, and then we shall then be able to keep in touch with you. And we have already had a number of people, cross-cutting professions, that have already expressed interest to join the school. And you could be one of them in the group. You could be having a brother that is interested in public health. Please, this is an opportunity to enjoy the 25%, because currently, I don't think that there is any university giving a 25% discount now, because it's a very difficult time. but ISBAT has chosen that much as it's a difficult time for them too, but they have shared their difficulty by giving their own contribution to this. So please take advantage of this and be part of the pioneer team. Is there any question?
Yeah, we have another question from Dr. Dula Ibrahim. He's asking more clarification on bursaries and half bursaries.
Yeah, okay. Well, this may not be discussed extensively here, but I think they'll provide you with the contacts that you can be able to discuss these details with the management and see how this is. And sometimes the bursaries are targeted to particular groups of people, but I know that the university has partnerships with other people. If funding is available, they can support you, but of course there'll be a process of application and the vetting. So it's not an automatic process, but it's the provision that's available for the institution. So you can get more information by getting in touch directly with the institution and understand how you may benefit from this. But currently, there is the ISBAT as a loan scheme program, which does not cut onto master's programs, recognition for that. But nevertheless, when there's an opportunity to offer, even if the bursary is in terms of giving you data bundles, it is it's a gesture in the right direction because you are being facilitated to learn. So all these aspects are there. I have always talked about people, and sometimes even flexibility of payment enables you to acquire what you have not acquired because you don't have lump sum money. So all these payment plans can be discussed with management. You can put a case across, case by case, and see how best can be managed. So please be free to be in touch with the university to get some of those details such that you make an informed decision.
Professor Okira, you can mention there is merit scholarship based on their performance and even some scholarship for the disabled.
Oh, so I have actually been informed by the Vice Chancellor that there are also performance-based scholarships. So it's now your duty to put your mind in the right perspective and excel and be able to benefit. So as you excel, you get the reputation of being an excellent learner and student, but you also get a scholarship. But there is also scholarships that are being offered to people with the polite word is not disability. Yeah, physically challenged persons in the process, and so as some assessment to be done and some concessions of some scholarships can be given to you. So encourage everybody to come on board, and we should then be able to have our futures shining brighter and brighter under this. ISBAT is destined to make your life, give your life a meaning, and it's just upon you to take it up now, and should be for the good of you and our country altogether. Is there another question? Okay. So we had in the program Dr. Tom, is he online?
Yes, I am.
Dr. Tom Usubuga, are you online? Oh, there was another Dr. Tom.
I am.
How are you? But there is a doctor there called Dr. Tom. I would want to hear from now that you are saying. How are you, Dr. Tom?
Maybe it's a different person.
No, it would be nice to know who he is.
He's taking a spark. You don't know who's
Dr. Tom, did you want to say a word? Okay. Okay. So, ladies and gentlemen, before we close this launch, I want to invite one of the deans, the senior deans here, to give a vote of thanks to the guest of honor, and then we shall have the meeting adjourned. Okay, Professor, you're most welcome.
Thank you. Thank you, Chair. Good morning, everyone. It's a great honor and privilege to propose the vote of thanks for this ceremony of launching of our MPH. I want to thank the Almighty God for giving us a chance to introduce the most desired graduate program under the Faculty of Health Sciences that mold professionals to serve the community in Uganda. I want to thank the Chairman, Board of Trustees for the initiative and the support to launch this program that will contribute significant improvements of the health sector in Uganda. First and foremost, I want to thank our special guests, Dr. Charles Olaro. Thank you very much, sir. That despite your busy schedule, you found some time to grace this occasion. And also thank you for delivering the inaugural address. I also want to thank Dr. Levi Mugenyi, a senior biostatistician and research manager of TASO Uganda. Thank you, sir, for your excellent word of encouragement to our students and prospective students. More so, also, I want to thank Dr. Patrick Mpima, the Registrar, Allied Health Professional Council. Thank you, sir, for your excellent proposal regarding the public health sector. I can't also fail to mention that we are grateful to our VC, our Vice Chancellor, Professor K.M. Matthew, for his words of encouragement, his able guidance, and we also thank him for his kindness, his interest, and his hospitality, and the continued support of our academic program and the general leadership of the university. I also want to thank Professor Charles Olaro. Thank you, sir. Kiria, sorry. Thank you for accepting our invitation, and also thank you for chairing the open session that we have just had. Special thanks also go to our first student who has just spoken, Dr. Anyonga Alfred, for participating in this session. And also, we want to thank our technical team for organizing this virtual event, which will be the order of the new normal in this pandemic area. Everybody's going virtual because of what is happening. Now, last but not least, I want to thank all the participants from all over Uganda for taking a keen interest in this program and coming forward with their suggestions. We hope this program will definitely help you all to go higher in your career aspirations, and you can also contribute for the improvement of healthcare sector in Uganda. And in conclusion, thank you everybody. Thank you for participating to make this meeting a success.
Thank you, Magistrate Professor, for those very, very kind words to our guests and our chief guests. On the behalf of the technical team that has been working around to make the Faculty of Public Health become a reality, that have been working around to make the programs accredited, written and accredited, and more programs. I am sure that the new programs of medical lab should have reached the office of Dr. Mpima, and I am not letting any bag out of any card out of the bag. I know Dr. Mpima does a thorough job in analyzing programs. He has the expertise persons to do this, and our prayer is only that they give us their feedback very fast, because those are programs that are required by, those are programs that are required to be launched too. So, ladies and gentlemen, I want to say it's been a pleasure to be a chair of this session. Special thanks to the Vice Chancellor, who has always called on me and said, Okiri, are you around? And the family of Vanges and the family of Isbat. I have found this as my other second home. And every time I am humbled when I'm invited to come here, because every time I've come here at the point of responsibility. And I don't take that trust for granted, because nobody will call you to chair something in his house. So I feel that's a good sign that you feel for me, you trust me. I am grateful. This launch goes a long way to open the eyes of the public and the people out there that ISBAT has now opened the Faculty of Health Sciences, and there are already programs that have been accredited. Number of programs are coming on board. ISBAT is a home. ISBAT is an institution where it will provide you with the environment of teaching and learning, research, collaboration, and also provide you with an opportunity to be a leader in the health sector. So my final appeal as the chair of today's launch is that guest of honor, we shall always call on you to give us guidance where necessary. We shall always be at your door to give us support where necessary. But our commitment to the health sector is that we shall do our best to get the best products that this country is looking for. ISBAT will do nothing short of quality in terms of teaching and learning, in terms of research and supervision, in terms of leadership, in terms of community engagement, to promote the public health in this country. I therefore want to declare this meeting launch, adjourn, and hand over to management for any other proceedings. Thank you very much. God bless you all.
Thank you, everyone. The session will be closed. Any doubts or queries, you can post your comments in the YouTube channel as well as in the Facebook link. You can also contact us. You can visit our campus and we will go back us.